All right, let's get started. Can you believe we only have like 2 classes left? I mean, come on. Gee whiz, time has flown. Okay, we'll push through. Okay, so there's several things I want to cover tonight. One, I want to first take some time to just be sure we're all clear about your final projects. You did get an announcement, not an email from me today. I included 3 presentations from former students. Now, I'm including those 3 presentations. Do not assume that those are A+ presentations. Actually, it will be a good exercise for you to review them and critique them on your own, to be sure that what you produce meets the expectation. Okay, so I mean, I'll tell you, they weren't failing presentations either, but each one could have been improved in some way, shape, or form. So don't go into this thinking that they're all perfect. So please take some time, review the 3 examples. You also have the example from the student that I shared with you during class, and that is embedded in one of the lectures. I think it's either the 2nd or 3rd class, I can't remember which one, but you have that so you have 4 examples to help inform how you will, approach your presentation. All right. Okay, so let's start just with questions. I know, Anam, you had some questions for me, and I asked you if we could defer. I wanted to defer my response because I felt like your questions would be appropriate for everybody. So I'll let you begin.
Yeah, so my questions were, let me pull up. So for the internal and external assessment process, are we just explaining what items we would analyze, but not actually complete analysis?
Yes, that's perfectly okay. If you have access to information that you can analyze, that's great. But if not, just walk through how you would do it. Okay.
Okay. And then the other question I had is the assessment findings section where we would conduct a SWOT analysis and potentially a pro forma as well.
So what's your question?
I said, is the assessment findings section when we conduct a SWOT analysis and potentially a pro forma?
Yes.
Do we need a pro forma? Because I saw in the other examples they didn't have.
Yeah, that's up to you. It depends on what you're proposing. Obviously, if you have something that has a significant dollar amount attached to it, you're going to need a pro forma. If your proposal is budget neutral, I think it'd be great to just include that in your language somewhere. That way I know that you recognize that a pro forma is typically needed, but for what you are proposing, it's budget neutral. What that means is that you're going to reallocate resources so that you can meet the need. Okay. That's the assumption when something is budget neutral, right? Because you're doing something different. So it's either going to require you to have additional funds to execute it, or you will just reallocate existing resources to get the job done. I just need to see that you have thought about it and in which direction you're going in. Other questions?
I have a couple questions. One, should we be considering how COVID might change things, or should we not include COVID if we're doing a health system?
I think that's fine. I think it makes sense to include COVID. That's a realistic issue, and it's not a requirement. But if your proposal would be more, if you think you'd have a more effective presentation by recognizing COVID, please do so.
Okay, and then another question I have is if we find actual charts or graphs from the organization with market share information or breakdown of like how, like the types of insurance people they are serving have, but it's from like a few years ago. Like I found stuff from like 2016, 2017. Can I still use it?
You can use that, and the best way to reference that, Rachel, so that it's easy, is just include the URL in the bottom right corner of the slide deck, of the slide.
Okay. And then my last question was, I see that a lot of the presentations are like 20 to like 25 slides, but I saw that it should be about 8 minutes. So is it okay if we don't like go like speak about every single slide like during the presentation?
You are actually asking a great question. So the rule of thumb when you are presenting is for each slide to be around 45 seconds to 60 seconds, because you don't want to lose your audience, right? And so the challenge that you have and the question that you should ask yourself for each slide is, what are the 1 or 2 big takeaways that you want us to leave with, right? So if you have a slide that has like 5 objectives and then you have like 3 subs under each one of those objectives, choose 2. And speak to those 2. Do not speak to all 5 of those objectives and all of the subheadings. Speak to the 2 most salient ones. I'm just seeing and appreciating the fact that you have thought about this comprehensively, and you have 5, but you do not need to walk us through each one of them. Thanks for asking that question. And try and do, you know, again, 45 seconds to 60 seconds per slide.
Is the order in the presentation, is that going to be the order
that you present? No, those are just the days that you're presenting.
Oh, okay. So will you choose or? Okay.
I just sent you an announcement and actually an invitation. There's an event that I am moderating on the 27th, which happens to be the same day of our class. So it starts at 6:30 and we'll be wrapping up around 7:30. So we will convene around 7:30 this class. If you're interested in attending the event, let me know. Love to have you. Other questions about your final project?
Do we need to have a minimum number of goals or objectives? Or can we just have like 3, or do we need like 5?
No, 3 to 5 is good.
Okay.
Any other questions? Okay, good. Again, my goal is to make sure that you are clear on the expectation. You saw the rubric, right? You should be able to access the rubric. And so I'm looking at several areas, right? One is just your presentation style, professionalism. So be sure that you dress the part. Also be sure that you have a background that is, that's not personal, right? So try and find, like I'm using a wall here that you don't see any of my personal belongings. So try and have a sterile background, or you can have a virtual backdrop, just so you have a more polished professional look. And, you know, I'm looking for you to convey interest, genuine interest and passion for this work. So you know, use inflection and please don't present monotone voice that kind of puts people to sleep. Show that you are excited about this work, right? I'm also looking for your ability to tell a story that reflects best practices in planning, and using some of the tools and templates that have been provided to you throughout the semester. I also recommend having a letter. You know how we talked about a letter from the CEO or board chair. You could, instead of doing a full-fledged letter, I'm going to give you a break, just do maybe a paragraph. That is my opportunity to see that you're able to speak like an executive So this would require you to look at different letters and strategic plans that are already published and create one that tells a story based on what you are presenting. And it can be from the president of the organization, it could be from the board chair, or it could be co-signed by the president and the organization. I know that this is not their actual language, so that's already an assumption. So you don't have to, you don't have to go out of your way to make that clear. So that would be very helpful. I'm also looking for creativity, right? And making sure, and try and have a design that is well branded. You know, if you can use infographics, if you can create really cool charts and graphs in different, more creative ways, take advantage of that. Okay. Oh, let me see. I think there's a question in the chat. Oh, okay. No question. Okay, good deal. So why don't we get started with our first group? Any volunteers? And it can't be a group that Kayshell is in because she had to step away for a second. So why don't we start Austin? Kayshell is not in your group, is she?
I think she is.
Oh,
right?
okay, of course. There we go. Amanda?
Did you say Amanda?
Uh-huh.
Oh, okay. Yeah, we can go.
Okay, great,
Kayshell's not with us.
great.
Okay, give me 1 second just to pull up the map.
Okay.
Um, Okay, I almost have it up. It just took me a second to find it. Okay, sorry everyone for the hold up. Okay, so I'm gonna go ahead and share my screen. But before I do that, I just want to grab my notes really quick. Sorry. I thought we were going last because
Oh.
group 4.
Oh,
but,
that's why. Oh, I'm sorry.
but that's okay. That's okay.
okay.
No, I'd like to go now anyways, just because.
Okay, so remember, it's the whole group. So are you the
Yeah,
selected
I'm the
spokesperson for
first.
the group?
We're all gonna go.
Okay,
If that's cool. I'm just
Okay.
gonna start us off and then it's gonna go in the order we kind of planned it to go.
great.
So
Okay.
sorry about my time. Okay, finally found everything. Okay. Oh, can you please allow me to share my screen, Dr. King?
Working on it.
Okay, thanks.
So you still can't, you can't share, can you still?
Let me try. No, not yet. It just says host disabled participant screen sharing.
Okay. Okay, try now, Amanda.
Okay, let's see. Okay, yeah, now I can.
Okay.
Okay, great. So I think everyone can see my screen now.
Yes.
Okay, great. So our group, we were group 4, and we were given the Center for Disease Control and Prevention, their places, which is a collaboration between the CDC and the Robert Wood Johnson Foundation, as well as the CDC Foundation. So I'm sure most all of us know who the Robert Wood Johnson Foundation is, and we definitely know who the CDC is. And so the functionality of this places, which is local data for better health, is it is an interactive map, which I will demonstrate in a little while, but it allows the user to better understand the burden and geographic distribution of health-related outcomes in their areas and assist them in planning public health interventions. So we know this is a really awesome tool to use as a public health practitioner for so many reasons. So the model uses a model-based estimate approach at the county, place, census tract, and zip code levels. And the project reports county, place, census tract, and zip code level data, and it uses small area estimation methods to obtain 27 chronic disease measures for the entire United States. And I will show you some examples of that when I demonstrate how the map works. And this system, the places system, complements existing surveillance data by providing estimates that are necessary to understand the health issues that are affecting residents of local areas and of different sizes, regardless of urban or rural status. This tool is really awesome and very helpful to develop and implement effective and targeted prevention activities. You can identify health problems and then establish key health objectives with this map. So one thing that I thought of when I saw this was how it can definitely be used for bridging gaps bridging certain like health inequity gaps, because we know data can show us that oftentimes they take place in certain zip codes more than others, or certain diseases are more prevalent in some zip codes versus others. So I'm going to go ahead and show you how to use the map. So the first thing you would do is you would go to the cdc.gov/places, and then you would get this, and then you want to go to the places data portal to view, search, filter, or download data. And this is again by county, zip code, or place. So click on this one. Oh, it just took me right back. Oh, sorry. Ignore that. Go to access the interactive map. I misspoke. And then you hit view the map. And now you can play around with it and find out different things. Okay, that's fine. So I thought this was interesting when we were, when my team was like meeting and talking about it, because being a public health student, we know that, like, for example, in the South, they have some parts of the South might have higher rates of type 2 diabetes. And we know this because a lot of the Southern culture, not all of it, but can contribute to those rates. For example, I think it was Oklahoma and Tennessee were some of the top 2 states with the highest rates of obesity. So this is an example, and then you could compare it to like a northeastern state, or Colorado, which I think is the healthiest state in the US, if I'm not mistaken. So I'm gonna demo it like in Maryland, And then I'll do another state just so we can compare. So we can look at type 2 diabetes. Again, it's going to take a little while to load, it said, just because it's like the first time or something. So you want to find the address or place to go to the magnifying glass. And I'm just going to put in my zip code 20866, which is Burtonsville, Maryland. And we'll just see what it comes up with. Okay, so we have Burtonsville. Why didn't it? Oh, sorry. Okay. We're going to look at Fairland, Maryland, which is right by Burtonsville. And in this area, the estimated prevalence of diabetes, I don't know if it doesn't say type 1 or type 2, but among adults aged 18 or older was 9.9% with a 95% confidence interval, and the age-adjusted prevalence percentage was 10.9% in 2018. And we'll get into like some of the limitations of this data, but for now, like you can see the total population and then the prevalence rates of diabetes. And then just to show you how you can compare, you could do like Knoxville, Tennessee. And then I just think it's interesting to compare two very different places for diabetes. Okay, so as we can already see for diabetes, it is higher in Knoxville, Tennessee. It's 11.9% with a 95% confidence interval, and the age-adjusted prevalence rate was 13.0. So it is a bigger population though, so that is definitely, we should probably, for like comparison purposes, pick a city that is like the same size as Fairland, Maryland, but you guys kind of get the picture, right? So I'm going to go ahead and pass it to Marina, and she's going to talk more about the map, but that is the map.
So I think this is a cool view, Amanda, because you can see the shaded, you can see using the shading, you can see where there's more incidence or prevalence than other areas. And that gives you a visual, right, where to focus.
Right. Okay, so I'm gonna stop sharing my screen. Okay.
And just to add on what Amanda was saying, PLACES stands for Population Level Analysis and Community Estimates. So as you've seen, you can look at different counties, you can compare. Sorry about my kids crying in the background. So you can, public health officials or anyone who's trying to do like a program or any initiative to improve those numbers or the health measures there, they can use this data to make decisions. Or maybe let's say Amanda was talking about diabetes. If you want to compare maybe counties that are geographically closer to each other and maybe start with the one that has the highest levels of diabetes and kind of, okay, maybe that would be phase 1 and phase 2 would be the second most highest from the ones you're comparing. So it can be really like the data can be manipulated and used to make different decisions. And it's really one of those projects that provide data at multiple local levels, like county, place, census, and zip code, as we mentioned earlier. And again, whoever is using this data, they can, retrieve it. They can, if they're more visual, you can look at the map and see, which areas really need help the most. And yeah, it shows all data in 50 states. And as I mentioned earlier, if we want to look at geographic distribution of health issues, right? We want to prioritize which area to focus on, or where we're going to invest some of our resources into that community, or whichever community we pick. So just really, generally speaking, using this map will help, establish, health objectives that the community really needs. And this was my part, and then I'll pass it over to Zinwa. Thank you.
Okay, thank you. So I'm going to talk about the pros and limitations of the map. Dr. King, can I share my screen or? I'm trying to-
You should be able to.
Oh, yes, I can. Okay,
Okay.
great. So firstly, I think one big limitation of this map is, for example, if you look at my screen, I was trying to load the map. I tried like 5 minutes ago and I'm still not able to load the map. Sometimes it works more quickly. Right now it's not loading quickly. So I would say that's one big limitation. Another limitation is that, as you can see, you can't use it on Internet Explorer. So at the bottom of the screen, it says you can see that the data is from 2013 to 2018, so it's not up to date. And another limitation of this is that you can only compare up to 3 counties only at a time. And then lastly, another limitation is that like someone who's doesn't know about like confidence intervals, or someone who's not like public health efficient or like epi efficient or like statistical efficient, they might not understand what a 95% confidence interval is, or they might not understand what prevalence of cancer might mean. So you have to know about like statistics or like public health data to understand what some of these things mean. And there are quite a few pros. Can you see how I changed
Yeah.
this? Okay, great, thank you. So firstly, one pro was you can export the data to Excel, which is great for Tableau or like SAS or like Stata. So you can easily like access the data and use that to create visualizations. Also, another pro is the introductory math is useful for those who want to see the estimated prevalence for certain health outcomes per condition, such as arthritis or asthma. It is useful for those who want to look at preventative health measures, such as the prevalence of health insurance and the prevalence of unhealthy behaviors, such as smoking at the county, place, census tract, and zip code level. And another thing I like about the site is that it's not very overwhelming, and I think it's organized, and I like how asthma, like the text is easy to see and like how big it is. And I like how there's different shades to show you where there's more of an incidence of prevalence. So like the darker colors, there's like a higher incidence of this condition or unhealthy behavior. And that's it.
Good job. I'm wondering, so it looks like we focused on health outcomes, but can you share the other tabs, prevention, and what the measures are there and the measures for unhealthy behaviors?
Amanda might be able to.
Okay.
And screen up?
Okay, sure. Because your
Amanda,
map is giving you issues.
Yeah, while you're teeing that up, let me address a couple of issues. So Zinwa, great point about the data being dated. Keep in mind, when we're talking about big data like this from on a federal website, it's likely to be dated because it takes a while to get massive data like this. And so typically these data sets are going to be 3 or 4 years old. So that's something to always keep in mind when we are looking at data, that it's always, you know, a few years older than when we actually see it. And yeah, it is, that's been always the issue with this website. It's very, it's so data dense that it really takes a while for, you know, your screen to refresh and all that. So I feel your pain. And I hear you also about confidence intervals and statistical significance. I think that, you know, think about the audience. Typically, those are the people who are going to be accessing these types of data, folks who are public health or epi folks or researchers. Very rarely will you have lay people who depend on a source like this for information. You may have some organizations that need this data for writing grants and so forth. But the audience for something like this is typically people who have this background. Any luck, Amanda?
Yes, I can go ahead
Okay.
and share my screen. So y'all should be able to see now.
Not
So
yet.
here I have, oh, you can't see.
Is it, you have to stop
It says
sharing.
it says my
Okay.
internet
It's Zenwa.
connection
It's
is
Zenwa. I keep saying it's Zenwa.
unstable.
Okay.
I
Zenwa,
might
did you
just have
stop?
an
No, I
Did you
stopped
stop?
sharing. Amanda,
Okay.
you were able, yeah,
There we go.
yeah.
Okay, great. So I went to the prevention tab like Dr. King suggested, and here we see all these awesome preventive measures. A couple that really stand out to me are dental visits and mammograms or mammographies. I mean, these are all so important. But I just think, and this, I don't mean to make this a tangent, but I just think dental insurance is not, it's usually not included in health insurance plans. So, I mean, yeah, it's something that people need to have access to, and I don't think it's usually like a separate thing. But anyways, I'll just use this as an example if you'd like. So I can search a zip code. Maybe not one around Maryland. Does anyone have a zip code they're interested in seeing?
90210.
Okay. Is that Beverly Hills? Oh wait.
Yeah.
Nice. Okay, let's see how they're doing in terms of dental prevention. My guess is probably pretty good. It's a wealthier area, right? Usually, yeah, Beverly Hills. So, okay, so let's see. So I want to see Beverly Hills exactly. Okay. This is, yep, Beverly Hills, California. Okay. Oh wait, it's like, sorry, the computer is so wonky. Okay. Ugh, keeps going away. Okay. Sorry guys. Okay. So in this area, Beverly Hills, the estimated prevalence of dental visits among adults aged 18 and older was 75.6%. Age adjusted is 75.3. So I think that's pretty good. I mean, most people are able to go to the dentist for their 6-month cleanings. And just while we're here, do we want to compare this to somewhere else? What's a more low income part of California maybe, or like a less wealthy city? Does anyone know? I don't really know anywhere in California.
Like, I don't know the zip code for like Crenshaw or
Okay. Oh, we can
Compton.
just probably
You can just type it in.
Oh,
Compton. Oh, maybe I spelled it wrong.
you spelled it correctly.
Oh, okay.
Yeah.
Crenshaw, Los Angeles. Is that one of them?
That's fine. That's fine.
Okay.
That works.
I do not know the West Coast like at all. So, okay, let's see what we get.
Well, that's cooking. You know, one of the limitations is it would be nice to have what the national average is, so you have some context. Like, okay, is 75% good or bad? Or give me more
Right.
information. So typically, what
So
you'll
true.
see on other platforms is, you know, what the national average is or what the state average is, so you have context.
Right, because then you wouldn't have to jump around
Right,
so much.
right.
And this map is so tricky with loading and stuff. It's moving all on its own. So it's like, okay.
And then you just have to stop, because the more you do, the more things will. Okay.
So Crenshaw is 51.3%. So that is much lower, about 25% lower than Beverly Hills. So yeah, could be for a lot of reasons, but maybe they're less insured, or like dental insurance is like a private entity in a way, and like it's not always covered by HMOs or plans that you can purchase through the marketplace. You have to kind of get it separately. So
good.
yeah.
So what are you don't need to give us an example, just click on the tab unhealthy behavior so that we can see what the measures are.
Sure. Oh, I see, unhealthy behaviors. So current smoking, binge drinking, physical inactivity, obesity, and under 7 hours of sleep. So that's an interesting one. I was gonna say, I
Count
can
me in.
tell.
Count me in.
I was gonna
Good.
say college students definitely fall into that category, and also just anyone working professionals too, but an
Good.
important one.
Okay, very good. Anything else you want to share?
Nothing really. I mean, overall, I like this map. I think there are limitations to it, but I mean, I still think it's like a really great map. I mean, I was interested to see more about what the prevalence rates are in my own town and how we compare. But I think 100% a huge thing they could do, like you said, Dr. King, is give us something to compare it to in some context. So maybe you can write to the CDC. No, I'm just kidding. But I mean, yeah, that's really great. What's the word? Really great feedback for
Good.
the CDC.
Yeah, absolutely.
Yeah.
So, the audience for this typically is, policymakers at a state level, federal policymakers. This is the CDC, so it's more at a macro level, but it can be very effective when planning state policy or federal policy, right?
Mhm.
So, all right, good job, very good. Why don't we
Thank you.
go? You're welcome. Let's go with Austin. Let's go with your group since I called you first. Okay, since Kayshell is back. Who's number 3 on your team?
We have
Hey,
Rachel.
Rachel. Okay, great.
Yep. So Kayshell, take it away.
All right. Let's see. I am going to go ahead and share my screen. Let me know if you guys can see it.
We got it.
Perfect. So the website that we had was the County Health Rankings and Roadmaps website. It is a program of the University of Wisconsin Population Health Institute, and it works pretty much, the program works to improve all the health outcomes and to help address health disparities for those who have the most and least opportunities to actually have good health. So I guess I will start by kind of answering like the first question, like what is the functionality of the website? So we believe that it was fairly functional. It allows us to look at different health outcomes, such as the length of life and quality of life, and types of health behaviors, such as health factors such as health behaviors, clinical care, socioeconomic factors, and the physical environment for each county of each selected state. And so I'm going to go ahead and type in a zip code. I'm going to use my zip code, which is for Upper Marlboro, which is Prince George's County. And so what it will do is it will load the information for that county that you chose. So it has, like I said before, it shows the different health outcomes, and that's like the length of life and quality of life. It gives you the percentage for the county, and then, the error margin, and then what the percentages are for that state as well. And so I'm just gonna briefly kind of scroll through. And what we kind of liked about it was, you have that comparison aspect. It allows for you to not only see the numbers for the county that you select, but also lets you compare from the overall state average. And then it also ranks it from least healthy to healthiest for both the health outcomes and health factors. And so it has different tabs. It has the overview tab here, which lets you compare the overall state and the counties within. And so it ranks it from 1 to 24, 1 being the healthiest and 24 being the least healthiest. We like that it was color coded, which is nice. And then it's also color coded based off of health outcomes and health factors. And so that's for like the overview tab. With like the actual measures, you can click on each county and then see the different measures for that. So for instance, if I click on Prince George's County, it will take me to that rankings site or the rankings tab that I was previously on when I typed in the zip code. And then you're also able to compare the different counties as well. So if you wanted to, you could say compare Prince George's County, or you could compare Prince George's County to then any other county within the United States as well. Let's see. Did I miss anything? I think that's it for functionality. Austin, if you want to talk about planning efforts.
Can we,
All right.
before you do that, Austin, can you go back to, is it rankings, just rankings? No, it's the overview, I think. Yeah, the overview. No, that's not it. What was the very first tab that you clicked on that showed all of the different measures listed? And you
Oh, yes. That was in,
okay, yeah, this is right. So let's just take a minute and just go through a couple so we can appreciate what Prince George's County is doing, what areas are doing really well in, and which ones are struggling in. I'm not getting ahead of your presentation, am I, Austin, or your other
No,
teammates?
you're fine. You're
Okay, okay. So so you see at the top it says show areas to explore and show areas of strength, right? So click on one or the other, whatever you're interested in. So these would be areas that the county is underperforming in when compared to other counties in the state. Okay, so I'm assuming that's what that is right there. What we see
yes,
is
it nicely
that's
highlights.
beautiful, isn't that great? So Amanda, you like that? So you see adult smoking, adult obesity, sexually transmitted infections. So it really just gives you an opportunity to hone in, like, where is the problem? And you see this is where we need to put some resources towards. Okay, so let's see what we can celebrate about Prince George's County right now, where we're doing really well. Okay, access to opportunities to exercise, not drinking excessively. Okay. College rates are higher, children in poverty rates are lower, income inequality is lower, injury deaths lower, and driving alone to work. Driving alone to work, I guess that needs to be low. Yeah, right. Okay. So that's a nice way to kind of hone in on strengths and areas to improve. And you can also see right here, I'm pointing, like you all can see my what I'm pointing at, but you see top US performers, the last two columns there. So you can see how this county is doing compared to the best counties in the country, or the best, yeah. And then how the county is doing compared to its peers in Maryland. So this is really a good tool to use. And again, this is for every county in the country. Okay, Austin, where does the District of Columbia fit in?
So, let me go ahead and-
Okay, so you see there's some cities also. I see Baltimore City. Okay.
You'd have to collect it or click on it to kind of get more information.
Good.
But I don't know if it breaks it down by the wards or not.
No, I doubt it. I doubt it does that. Okay, good. So y'all see how, if someone's doing, a health system in Maryland or Virginia, this would be a really good tool for you to use as you think about your plan. Okay. All right, Austin.
All right, so answering the second question here. So how does this inform planning efforts? So in a few ways. So as we just mentioned, with the features, the show areas to explore features, show areas of strength features, planners and people that want to conduct an intervention can really hone in on specific measures that need to be brought up. Another feature on the main measures page. So if you go back to Prince George's County on the measures page, you'll see little graphs to like the right, And these essentially indicate if that measure is improving, if it's getting better or worse. So say, you want to find the worst of the worst problems to prioritize, you could find a measure that you need to explore. And if that measure is going down or is getting worse, such as in the case of Prince George's County, it would be sexually transmitted infections. That might be something to focus. So what you can do is you can actually click on that measure itself. So if you go back and you click on sexually transmitted infections, that link there, that blue link, so you'll essentially come up on the screen as we've kind of seen before. And if you go all the way over to the blue text that says strategies besides data source, there are actually a number of scientifically, evidence-based strategies to kind of mitigate this issue. So this could, of course, enhance planning efforts and help inform planning efforts in the sense that you'll find problems that are priority, and also you'll get this kind of catalog here of, evidence-based interventions that work for this particular issue. So I think this is a very helpful tool for people that are wanting to conduct an intervention of some kind. And then something else. So if we go back to the main measures page for Prince George's County, then so some of these measures variables here, like we could click on premature death up top under length of life. And you can see if you go to the data tab, you can see how it's stratified by race. So you can determine which specific, in your county, which specific race is experiencing, is doing the worst in this category. Based on the measure, and I think based on the date or the year of data used, you can find different measures, such as you can stratify these based off of income, based off of gender, based off of age. I know it's kind of incomplete in some of these, but I know this measure itself typically has races stratified. So that's another way it can inform efforts, in addition to all the other tools that we've seen on the measures page. So that's pretty much it for that section. Yeah.
Okay, thank you, Austin. I'll continue. So some positives that we liked about the site based on our assessment is the use of the visuals and the graphs. So like that breakdown using the different shading and coloring is easy to use. I mean, obviously we would maybe assume that this data is going to be used by people who would understand, ratios and percentages and whatnot, but at least with those visuals, it's easy for anybody to understand. It's also good that for each measure, it's comparing it to the state and the United States. So you kind of have that picture of like, what is it like in the regional context, and then what is the national context for the health behavior or outcome. Inclusion of social determinants in the health outcome section, I think is important. So like things like poverty, violence, preventable deaths is important because you can't really accurately assess things like early death and obesity if you don't know about things like, are there places to exercise, and what's the food situation like in the neighborhood. And something else that I thought was strong about the website, as you can see from Austin's demonstration, there's a lot of different data and it comes from a wide variety of sources. So for example, the CDC's National Center for Health Statistics, the Census Bureau's American Community Survey, the Behavioral Risk Factor Surveillance Survey, which is also a CDC survey. So some strong data sources. There are some limitations for the website though. So the sort of the essence of the website is like summarizing health and then like making this data available to researchers and such so that they can use it to improve health outcomes. But there's really no single best way to summarize like what is the healthiest county. So there's a lot of measures that may not be easy to put into this website. So things like discrimination, healthcare provider quality, experiences and clinical encounters within health systems in these counties. So it's definitely hard to define like what is the healthiest county, but it does do a good job of, making the best attempt at that. Another thing is that in terms of rating counties, there's obviously within a county, there's towns that have their own diversity. So like you could have a county where there's a bunch of wealthy towns in it, and then there's also some lower income towns. And so the overall rating may be sort of drowned out by the wealthier towns. So you may not get the full picture of a county that has some towns that are struggling financially or in other socioeconomic ways. So that's something that's important to consider, that the ranking may not be descriptive of every individual living in each town. And that is kind of a summary of what we wanted to go over today. Are there any questions or anything else that anyone would like to see from the website?
Yeah, others chime in, questions, thoughts, reactions. Was this your first time using this website? I'm talking to the group that's presenting. Not your first time, Austin, okay.
It was my first time, to be honest.
Okay.
I actually use this website for a community needs assessment in the community health undergrad
Great,
program. So it was pretty helpful.
great. Okay. So yeah, so this one's easier. It doesn't take forever for the pages to refresh and for you to get what you need. I love it. I think it's great. The Residential Segregation Index, did you all take a look at that? No? Okay. Do you know how to get to it? No? Okay, I can share that with you a little later. All right, let's go with the next group.
We can go.
All right.
All right. Okay, so we are doing community comments.
All right, and I'll start us off. So I'll just go over the doc that we put together. So Community Commons is really a collaborative initiative between different communities. So if you're part of a community, you can submit your data, your resources, anything you found out during your time, researching or doing work for the community. And it was started by a nonprofit organization called the Institute for People, Place, and Possibility, IP3. So the main thing that we found that this website is helpful for in terms of like planning efforts, it can provide like community leaders with information and tools to help them address issues. And we've noticed that overall, like compared to the last two resources that we just saw, this website is more like qualitative data heavy. So it's very about telling a story, about a narrative, about a specific topic or issue in a community. And so it's like very general, but it gives you lots of background information, anything that's related, it'll link you to that information as well. So what did we like about the site? So we really, really liked how there are things called topics and collections, and they allow you to link relevant data together. And as we'll do a demonstration of it later, so you'll be able to see it more properly. But like when you click on a topic, it will show up a bunch of different related topics underneath there. And so everything like under COVID-19, or specifically if you're doing like something about, I don't know, health or race issues or something like that, they'll show you a bunch of related topics to that. So it's really nice for that. However, we did have quite a few issues, or at least things that we saw were limitations with the site. For instance, there was a lot of, while there's a lot of content available, there's not a lot of filtering data information. So they have like a very select, like a list of topics that again, you'll see with Esley more, but it only allows you to filter by certain things. So it's very difficult if you're looking for something very specific, or you have to really drill down to really know what you're researching, what you want to know, because it's very, very broad. And other things is that although the topics and the collections pages and have related data was really helpful, we found that it was a lot of like redirects. So it would really bounce you from one page to the next, to the next, to the next. It wasn't like if you clicked on a topic or any of these files that Esley is scrolling through, like it won't show you the data right then and there. You have to click out to another link, and then maybe you'll click out to another link. And it's just a lot of like, if you're trying to research a bunch of stuff, you have a lot of tabs open at a certain point, and it'll get like really, really frustrating trying to keep track of all the data. But And also, again, like we mentioned, there's a lot of data, but a lot of it's like kind of half and half. Some of it's more like blogs and like opinions. Other things are more like podcasts, like you see there. Some are reports. There are not that many. We noticed we didn't see that many government related documents. There were a lot of like from other communities or other organizations putting in their own information. Again, this is a community based website. It's for the community and it's content provided by the community. So maybe that's the reason. But it's not really like hard data that you would find like in the last two resources we just looked at. And I think that's it. Esley, did you want to do the demo now?
Yeah, for sure. Another thing that we did want to point out is Community Commons themselves do have a podcast. So I personally, the first thing I searched for was Montgomery County, which is where I live. I just wanted to see if they had more local data because since it is a community-based website, I assumed that there was going to be local county or city level data, but nothing came up. So um, for this specific website, what I found is easier is to just search broader terms, like Anam was saying. But we did find that this podcast has some state related topics, but it's not data, right? It's just a podcast. So I did want to demonstrate and I did want to ask, can someone just tell me something health related to search in the search bar?
Hospital.
Hospital? Okay. Perfect. Okay, so as Anam was saying, it is a lot of redirecting. So here, at first I thought this was a warning message. The one that I saw was a little bit longer, so I kind of overlooked it, right? So another thing we had a little bit of issues with was the design, just the organization of everything. Nothing's really, how she was saying, filtered correctly. There's no categories in certain pages. But for example, let's say we're searching hospital up and then, oh, cool, community health needs assessment. So since we were just talking about that, we can click on that. They do have really good descriptions. So every topic that you're looking at, every resource that you're looking at has some sort of description. So you are never, you always have some information regarding whatever you're looking at. So here, okay, we have resources, we have tools, some mapping tools, we have reports, we have federal guidelines, which is very interesting. So let's just click on that. Um, and there's a little summary here saying, okay, so there are regulations that provide guidance for charitable hospitals. So this seems like it would be some, okay, but it's 2014. I don't know if it's outdated or not, but this seems like it would be a document that, a healthcare or hospital professional or executive would be looking at if they want to use it for the community health needs assessment. So yeah, there are different channels like economy, equity, food, health, housing. Some of them are blank. Just I assume no one has data or any resources to put in there. Um, but yeah, but overall, that's kind of what we think. We think it's a good starting point for more general information, but it does need, and my assumption is because it is run by a nonprofit, that's why there's some like, I guess like graphic design issues and just organization of the resources. But overall, it's a good starting place.
So did you all go into the maps and data tool?
Yes.
And actually, because you can do your own query. I thought you could. No? Isn't
No.
there a way for you to explore data? No?
So you can explore data, but from other sources. So let's
Okay.
say I want to look at, I don't know, the places. I have
That's
to,
where we just went, right?
Right, so I have to
Right.
go outside. but-
Okay. Okay. It used to be that you could explore data and create maps and do all kinds of cool stuff using their. Okay, I see what you're saying.
Mhm.
Okay.
Yeah. I did read somewhere that they did go through some change. I'm
Yeah.
not, I don't remember that might have been part of it.
Yeah, I'm pretty sure.
Mhm.
Okay.
Yeah.
Probably less labor intensive, easier for them to, seems like this is just a site that's curating a lot of information from other resources. And
Exactly,
putting them in one
exactly. But
place.
it is up to date how Anam was saying there is like COVID stuff,
Mhm.
which is great. And let's see. I'm sorry, it's having a hard time loading for some reason. My internet is fine, so I don't know if it's the website. Yeah, so a huge topic like COVID-19 does have categories. And obviously it has to be updated, data and
Right.
resources. Mhm.
All right, good job.
Okay, thank you.
Any questions for this group? Reactions? Okay. And let's go with the last group.
All right,
Who's
so
gonna take the
start
lead?
off.
Michelle, okay.
I'm gonna share my screen. Can you see my screen?
Yes, we can see it.
Okay. So we looked at DC Health Matters, which is part of the DC Health Matters Collaborative. It is a coalition of hospitals and community health centers that include 4 nonprofit DC hospitals and 4 community health centers and a few other members of the community. And it has like all the data available through the DC Matters online portal. So we specifically looked at this online portal, and the purpose of it is to basically give a list of public health indicators that affect the health of the DC community, so they can compare to both other states and as well as like the whole country data as well. So I started off by looking at the community health dashboard. So this includes, you can filter by different indicators, or you can look at District of Columbia, like the whole region, or look at different wards. And it also goes down, looks at specific zip codes down here. So I started off by looking at just a list of all the indicators that they have. So it's broken down in different categories like health, alcohol, and drug use, health center, health or cancer, health and diabetes, health disparities, and all those. And over here, it looks at whether they have the city data, which they have for almost all of them, zip code, wards, and stuff. So down here with health and disabilities, they have both city data, the zip code data, and census tract as well. So going back to the main dashboard, you can look at, also you can look at all data, which has all the indicators for all the populations. So just looking at the first one, adults who binge drink, it's saying that the value in the whole District of Columbia, DC is 24.8, and the US value is 16.9. So since the red color indicates that the DC is not doing too well, and the green color indicates that DC is doing well. And then you can also turn the colorblind mode on, which gives you like a thumbs up and thumbs down. So like I said, the red means that thumbs down, DC is not doing too well. And then, for example, the green one here shows that the DC is doing well. And then these are all the different indicators. And you can see at the top here that they change. This is health, family planning, and all of the one going down. So I won't go through all of them. And then what another good thing that I found about this, that it looks at the Healthy People 2020 and Healthy People 2030 as well. So you can select that, and then same thing, you can look at the whole DC, you can look at different wards or zip codes, and it shows whether compared to Healthy People 2020, if DC is doing well or not. So the red again means that it's not, it's 24.2 versus 24.8, and then the green check mark means that DC is doing well. So then you could also look at specifically, like for example, Ward 8. just give it time to load. Okay, so then this is specifically Ward 8 data, so it shows that it did not meet any of the 2020 targets for all of the indicators.
Now,
And
can you just do, sorry, can you just do Ward 3 just for my own personal? Because these are the two most vastly different wards in the city.
do you see the difference?
Yep, yep.
Yeah. So this means that for Ward 3, we only have health, maternal, fetal, and infant health indicators. We don't have all the other indicators. But if you look at like just the whole DC, you can see all the various, like I said, these are all the different, like, you know, heart disease and stroke. Like we don't have that data for Ward 3 or Ward 8. So that's basically like an overview of it. And I'm gonna go back to the main.
Can you do the disparities?
Yeah,
or someone else doing that?
Yeah, yeah. So like I said, there's 2020 and then there's 2030 as well. So it shows both 2020 and 2030 for all of the indicators. Like I can look at Ward 3 again and see that, you know, they're on target for both of them. And then Ward 8, that it's not for both of these indicators. So I will go back to the disparities one now. Okay, so looking at the disparities dashboard, it looks at 3 different factors. All right, so it looks at age, gender, and race and ethnicity for each of the indicators. So you can see like it breaks down by age over here, gender, ethnicity for each of the indicators, for whatever data they have available. So same thing over here, the green means that it's doing well, 66.2, and then DC is 58.4, and then the red means that it's not doing well for all the indicators. And then, like I said, you can also, for example, I was looking at Ward 7 for like all of them, and then this, you can sort by each of the location and each of the indicators. Like you can check off indicators right here, and then, you know, hand pick indicators or whatever. And you can do search. And this down here would just be like all of Ward 7 for each of the indicators. So it's I think it was pretty comprehensive. I like the long list of indicators. You can check off indicators, check them on, and we can sort by location. So those were some of the features that we liked about the site. And then Christine can talk about some of the things we didn't like about the site.
All right, do you want me to share? Okay, I'll share my screen. So I just want to talk or touch on a couple more things that I did like about the website. For one, I just like that it's just very comprehensive. They provide an easy way to access all the resources that you need, from just like being able to pull things down and easily see things. I just clicked on the link. But my computer's a little slow right now, so give it some time. But this should be a drop down. It's not dropping down, but it should. And you can easily search things. But if you, for example, don't know what to search, right here, it shows already indicators that you can see. And then you can always use these and then learn more about them. So it kind of like intrigues people that are interested in it. And then also at the bottom, it has just easy measures to navigate the website if you do need any assistance, which I do appreciate. I also like that it has promising features or practices that they want to institute. So a big part of their page is not only showing ways to just assess, but also a more forward action towards it. So if I go to these links, for example, it will talk about sort of outreach and practices that have been done in the DC area. And then it also has an option to submit a promising practice. And these are just awesome ways for like people that would utilize this, such as hospitals and community centers, to be able to just see what can be done or what is being done. I did want to talk about one weakness or one limitation that I thought was really bad. It's their maps. I really struggled with this. And so yeah, they have a bunch of different filters and categories that you can base it off of. So for example, I'll just go with USA poverty ratio. I just click on view map. Okay. Sorry, my computer is super slow right now. What country am I in? Okay. So as you can see, this is kind of odd that it's not actually on the United States at all. Even without my computer acting this slow, there were no colorings to describe pretty much what was going on. I can put in a simple, what is it? Yeah, like a simple location or zip code in the district, and it won't actually show anything. As you can see right here, I was having this problem earlier. There's not really anything to kind of navigate with or any like cues. It has this, but it doesn't actually overlook it. So that was very challenging. And I had pretty much that issue with all of them. I could try another one. I don't know if my computer's gonna act up again, but that was a big problem for me, so.
Yeah, I want to
Yeah,
jump
as you
in
can
and
see.
say that we both were trying to access a map, and it's just not easy to navigate on the website.
Yeah. And then returning back. Even getting out of this is a little annoying.
So this is just an external, this is just,
Oh, okay.
where are we on the website? Are we in the,
Oh, so
promising
this-
practices,
so they-
okay,
so it's-
okay.
Yeah, so she showed finding
Yeah.
data, and then I was focusing on exploring the map,
Yeah,
which is a pretty big segment of their website, but it's just, you can't really
Right.
manipulate it very well,
right,
which is
right,
kind of
right.
frustrating. However, I did like their locating resources aspect, which shows community health needs assessments for the past few years. They actually did one earlier than needed that they're working on, which is really cool, that they spoke about in their About Us page. And they also have improvement plans, which are very detailed, and some publication information for COVID. And then learn and take action. Again, they're very action focused, and will provide resources for people to get involved, or how other stakeholders have gotten involved in the past, which I thought was really great. But yeah, about it. Any questions or anything else that you'd like to see on the website?
So remember, this is a site that's very specific to DC. You're not gonna find this site in other, other cities that's similar or consistent. You may find some, but this is very specific to the District of Columbia. Okay, so you're not gonna find this for, Baltimore City. They may have their own, but this is very unique to DC. So, it's really helpful for me in the work that my students are doing, around health disparities, especially using that disparities dashboard. And it's important to note, like you were saying, I think Amanda earlier, just because, or may have been you, Rachel, I think it was you, it was you, Rachel, just because a city or a county is in the green, meaning that everything looks really good, we don't stop there. We dig a little deeper and we look at specific populations. And when we look at and stratify data by race, ethnicity, or socioeconomic status, you're going to have a very different story. So like in DC, if you look at obesity, we are in the green. We look like we are just all track runners in this city. But when you actually look at us by socioeconomic status and race and ethnicity, it's a very different narrative. So we have to be granular in our thinking. All right, good job, good job. Very good. So I put in the chat county health rankings and how you get there. I think it's a very interesting, let's see if I can do this. Okay, cool. So you can see here, you can explore data and you can select a state. So this is at the state level. So let me just do DC. And I think DC is around 68 or 69 when it comes to the residential segregation index. Yes, we're 67. So basically 100 means that the community is completely segregated. A value of 0 means that a community is completely integrated. Okay, this is a public health measure, right? Because we know that the more segregated a community is, the more likely we're going to see disparities, right? The more likely we're going to see a difference in people who live south of Main Street versus north of Main Street. And so it is a public health measure. So, so you can, well, it looks like you can compare, well, you can't do that. You can only look at the residential segregation index at the county level. So does anyone want to just, I think there's some cities that we can do. Let's look at the data here. All right, you can do District of Columbia. Yeah, so it's all at the, it's at this, let's do Maryland. And then we can go, then we can select the county. Now I remember. Okay, yeah. So you can see all of the different counties. Oh, there's Baltimore City. So you can see that the most segregated jurisdiction in Maryland is, it's like Baltimore City, right? Interestingly, Baltimore City and Washington, DC have a consistent value. I think one of the most segregated cities in the country, if I'm not mistaken, I think it's Chicago and Miami. Let me, let's do Illinois. Oh, it's hard. It's going to be difficult to do Chicago because Chicago is multiple cities. What's the main county Chicago sits in? Who remembers?
I think Cook County.
Is it Cook? I think you're right. You're absolutely right. Okay, so here it is, Cook County. So you see, yeah, 77. Crawford County, 85. That's really, really high. And I'm assuming the ones with high values are maybe Baltimore, Chicago suburbs. And then just curious while we're here, I want to see what's going on with Miami. So Florida, if I'm not mistaken, Miami-Dade is one of the most, oh, no, I'm wrong, 69. But anyway, you get the gist of it. So just keep that in mind. I think it's a great measure to consider, especially if we're talking about disparities. All right, we're going to wrap up in just a moment, but I want to be sure that I cover conducting a business plan. Be sure for your final that you know the difference between a strategic plan and a business plan. They're somewhat related, but they're very different. And so let me just very quickly walk you through these slides. They are already posted for you in Canvas. All right. So I'm really just giving you a crash course on developing a business plan. So it's a method by which a healthcare organization, because we're just talking about healthcare right now, evaluates future investments in a business initiative. And so what I want to do now is just give you, I guess, the table of contents for a business plan, right? Before I do that, let's talk about the purpose. To obtain financial support. So let's say that you're trying to build something, you need to have a plan, and it needs to appeal to investors or philanthropists or whoever you're going after to seek financial support. We also want to be sure that we're able to take this big plan, this grandiose idea that we have, and operationalize that, right? And so it needs to be well documented. A typical business plan is going to be, you know, it's going to be large. It's going to be like a book with all kinds of content and appendix and maps and charts and graphs and everything that you need to do to be sure that you have done your due diligence, so that whoever is going to invest or whoever you're appealing to sees value in it and wants to be a part of the work. To identify the strengths and weaknesses of the organization and its competitors, and to develop a strategy for growth, and to develop guidelines. So remember, successful business plans are data-driven and they are informed by experts, and they're very aspirational. So these are the components of a business plan. You always have an executive summary, a description of your business, a marketing plan, an operations plan, and a financial plan. And then you follow it up with an appendix with all your support documents. So you all know this, but an executive summary is just a reader-friendly version of whatever it is that you're sharing with the audience. It's abbreviated. It should be concise, highlighting main points of core areas. After reading the summary, the reviewer will have an informed sense of the organization, an informed sense of its direction, as well as its inputs, its unique position in the market, how services will be marketed, and how goals will be operationalized and financed. And they begin with a cover sheet, the official name of the entity, and whoever your top leaders are. So these are the components of a business plan. One, what is your legal status, right? Are you a 501c3, a sole proprietor, an LLC? What type of business are you? And there's a federal code for different types of businesses, and I've listed some examples for you: merchandising, manufacturing, and service. A description of your business with justification for how it meets an unmet need. Now remember, a business plan does not just apply to a not-for-profit. A business plan is a business plan. It doesn't matter what your status is. Your hours of operation of when your services will be available, and any additional information that the reviewer will want to see. So remember, the business plan description is, what is it that you're offering? What is it that you're presenting to the world or your community? Why is this service needed, and why is it unique? So think about Shark Tank, right? Think about Shark Tank as a perfect example. Where will the services be located? Let's think about the 4 Ps here, right? If additional space is needed, is there a need for a certificate of need? How will it be accessible? Again, think about the 4 Ps. And if there are marketing shifts or emerging trends in utilization. So explain the planning process that was undertaken to obtain the SWOT. A business plan also has a marketing plan. So that marketing plan defines your customer. Who is your customer? What are the demographics of the folks you are trying to reach? What about the psychographics of the folks you are trying to reach? What's happening in the market with whatever it is that you have a plan for? Where does it fall on the product life cycle? How do you place your product in the market, and what will your strategy be for increasing market share and your pricing strategy? So all of this is the table of contents I'm sharing with you. So there's a whole section on defining your consumer. There's a whole section on market trends. There's a whole section on strategy and placement and pricing. There's a whole nother section on your competition, because whoever is invested in investing, or you want to invest in your product, they want to know what's up with the competition and where do you fare. So this goes back, sounds like SWOT, right? Give a general overview of the competition and any threats, identify competitors. How do you gather intelligence, and what distinguishes your product or service from the marketplace? Let me stop here and be sure that I'm clear so that you understand the difference, because it sounds like what we've covered with a strategic plan. A business plan is a specific plan that you have around a specific product or price or intervention in which your goal is to increase your market share. A strategic plan is holistic, based on your entire institution and where your institution's going in the future. So you can have a strategic plan, and in that strategic plan, you can have a business plan that is, let's say you want to build out your pediatric wing, right? That's part of your strategic plan. But then you need a business plan around that particular component. What is that going to look like? So it's more work. All right. How do you advertise and do your PR? And what are your operations plan? We want to know everything about who's your leadership and what are the bios of the people who are running the organization, your senior executives. Who's your board of executives? Who are your shareholders, right? We want to, that all needs to be clearly presented. What are the management team's strengths, weaknesses? Discuss any gaps in expertise and how they will be addressed. Well, you have to outsource any services. For example, some organizations have to outsource human resources because they just don't have the infrastructure for that. Or you may need to outsource vendor who can cover your IT issues. Describe personnel needs and how they will be addressed. How will you orient, train, and ensure compliance with your annual competencies? Is this service or your organization going to be accredited? And who will manage the process? So you get really, really into the details. And then your financial management plan. And this is where you have a lot of content, including your 2 to 3 year pro forma. What is your break-even point, right? Is it going to be 2 years down, 3 years down? What's your break-even point? And then I have for you a few tips on presenting the plan. Let me see. Okay, so yeah, this is a great video to look at. We're not going to do this right now, but I would encourage you to take a look at the video. It could be very helpful. And then this is a really good video, so you can see an actual presentation from 2 students at GW that did a really, really good job. You know what? We don't have time. Well, we do have time, but I want to give you some freedom and watch the video on your own time. Watch these 2 graduate students talk about an idea that they have that they'd like to introduce into the market, and also listen to the questions that the audience will ask them and look at how they work together to kind of spread the responsibility of telling their story. I think they did a really good job. So again, what you're seeing with these 2 is a business plan. Again, think about Shark Tank, right? What's going to be your return on investment? How much does it cost per unit? How much are you making per unit? You know, who else is out there doing this work? Why is your idea unique? Okay. Any questions?
Dr. King, do you
Yes.
know when our final exam is going to be?
It's going to be during exam week. And so it'll be open during the same time that exam week is. And just like we did for your midterm, you just choose a day that works or time that works for you during that period.
Thank you.
Mm-hmm. And I will provide you with a study guide. And it will be comprehensive. Okay. So are you clear on the business plan? And again, watch the video. I think that'll make it even clearer for you. But strategic plan is enterprise-wide for the organization, the institution. A business plan is much more specific to something that you need to do that has with the ultimate goal to have a return on investment and to increase your revenue stream. Okay, good job. Good job. So we will begin next week with the first group. The second group, remember, we have a student who is watching the videos online, and I'm working with her individually, but she will also have a video. She's doing a video, and so that will be accessible to you so that you can see her video as well. But she watches our class on a weekly weekly basis. Hi, Elizabeth. I know you're watching right now. You're watching it tomorrow. We see you and we wish you could be here with us. I think most of you know Elizabeth, right? Okay, good, good. She's pretty awesome. Okay. All right, so we'll stop here and wish everyone a safe evening. And if you have any questions in the interim, please shoot me an email. My UMD email is now working again, so I can get the emails in a more timely fashion. I had after class last week, I was literally up until 12 o'clock doing all of those trainings for IT. They were asking questions about what do you do if your laptop gets stolen? I mean, just very simple questions that you're supposed to watch the video and then you take the quiz, but I kind of bypassed the video and just see, I wanted to know if I could answer those questions without watching the video, and I was able to do it I did a pretty good job. There are a couple I needed to go back and watch the videos. But I was up until 12 o'clock last Tuesday, because I was so bummed out because you all could not get logged in. I just felt so embarrassed. Oh God, the world is just going crazy. I'll stop here, you all. You all have a good night, okay? I appreciate you, and I will talk to you and see you next week. Bye-bye.